Good evening, everybody. Thanks for braving the weather and coming out this evening. Looks like we might be getting our first big snowfall of the year this whole season, really. I'm Dr. Jason Myers. I work with Lakeshore Health Partners in Family Medicine. I'm the medical director of our New Zealand facility out off the exit in number 55 in Zealand. We've been there about a year now. The office opened October of a year ago. We've gone through our first full year. We provide family practice out there along with the walk-in care. We also have full facilities including lab and x-ray and bone density, mammography, women's health, urology, all out in our facility. So it's kind of a nice one-stop shop for primary care. I've been asked to come here tonight and give you guys a little talk on kind of how to find a primary care physician or a new doctor for that matter. It could be a specialist or a primary care provider, and what things you might want to ask that provider when you do see them, and then also if you do decide you want to build a relationship with that provider, how to maybe talk to that provider about some of your healthcare needs. First of all, there's very few reliable measures out there in the community in order to rate sort of physicians or to find a good physician. You can go online. There's some rating sites or some sites that the insurance companies have to try to rate physicians and give you, 3 apples or 4 stars or things like that to try to give an idea about how good a physician might be compared to his peers in the area. The problem with those ratings are there usually only 2, 3, maybe 4 people have actually put their opinions in. Most physicians have close to 3,000 or more patients in their patient pool, and so a pool of 3 or 4 just isn't really a good representation. And a lot of people that go on the internet typically are either people that weren't happy, and so they tend to go on there to tell everybody they weren't happy, or they're very happy and they go on there to tell everybody they're very happy, and so you get kind of this skewed one side or the other kind of spectrum. So when you're looking at those kind of websites, just make sure you take them with a little bit of grain of salt. Really look at the number of people that have actually left feedback on that physician. If it's a good high number, even in probably the 20 or 30, you're probably going to get at least a decent idea of whether they're good or bad. If there's 30 people that went on there and said, don't go see this guy, well, that's probably a pretty good idea that maybe you don't want to go there. And if there's, again, 20 or 30 people that have all said positive things, it's probably a decent measure. But just remember that those numbers can be fairly low, so watch that when you're looking at those sites. The same information can be available on some of the healthcare insurance sites through Priority Health, and some of the other websites will also have ratings about their providers and how well they do. So you can look at those sites. Most people, however, learn about a primary care doctor either through maybe advertising or through a friend or a family member or somebody at work. And while those are definitely good referrals, I always like it when some of our current patients refer other patients. That at least means that they like us enough to tell their friends to come here. You also aren't going to get a lot of depth of information from that, and so you're kind of still going to be walking into that encounter a little bit blind about how is that physician and what is it going to be the right physician for me. Even if it's right for your friend or your family member, it may not be the right doctor for you. So you need to make sure that you meet that doctor and talk to him to make sure it's somebody that you want to see. So we tend to rely on word of mouth, and that's kind of how we get a lot of our referrals, and that's how a lot of people end up finding doctors. When you're looking for a doctor, you want to ask the questions about what is it that you really need. Are you looking for a primary care physician, or are you looking for a specialist? Because it kind of has 2 different connotations to it. A long-term relationship you're going to develop with your primary care doctor, but with a specialist it might just be you might only see him once, maybe twice, and then never see him again, maybe even ever. So it may not need to be as quite an intense relationship with a specialist as it might be with a primary care doctor. When you're going to see a surgeon, sometimes it's more important that they're a great surgeon than that they have great bedside manner. You don't really necessarily care too much about that because you're only going to see them once or twice and then they're going to be gone. What you really want to know is that your knee was replaced well, your gallbladder got removed good, and that kind of thing, but you don't necessarily care if they have a great personality. However, when you are developing a relationship with a primary care doctor, you're going to see a lot more. You're going to be giving a lot more of your private information to. You're going to be asking a lot more questions. You want to have a little bit more intimate relationship with that provider, and it's going to be a little bit deeper, and so you want to make sure that's a good fit. Once you get a couple ideas about maybe doctors that you want to see, you do have to check kind of with your insurance company. A lot of insurance companies you might be part of an HMO or part of a PPO or something where you actually have to see certain providers that are in that group. So before you call and make an appointment, make sure that provider's office participates with your health care plan. That may help you rule out one or two providers on that list also. So it's really important that if you say, hey, I'm going to go see Dr. Myers, let me make sure he actually accepts Priority Health. We'll call the office or go on to Priority Health's website and look at that list of physicians and make sure that the doctor that you want to see is on there. It wouldn't be great if you went there and you met him, you really liked him, but then turned out you didn't cover your insurance, so then you have to go out and still wasted your time looking there. You also want to kind of consider the location of the facility and what are their hospital affiliations. In large metropolitan areas, there might be 4 or 5 different hospitals that the physicians might be affiliated with. Maybe you don't like one of those hospitals in that community, and if your doctor is intimately tied with that hospital, that could present some complications for you. So look into where their location of their office is, make sure it's close to where you live or work, it's somewhere on your flight path. You don't want to have to drive necessarily 30 miles out of your way to go see a doctor. So look at the location, then also talk about some of the affiliations about where does that doctor admit his patients, where do the patients go to get labs, that kind of stuff, and make sure that's a good fit for you also. You also want to find out, and you can do this online a lot of times or by making some phone calls to the offices, they make sure that the doctors are certified in the specialty that they're in. Do a little background check on that. There are several websites online where you can actually go and you can find out where I went to medical school and how many years I spent there and where I did my training. It's quite surprising. Sometimes I look at them just to figure out where did they get this information from. But yeah, there it is. So you want to make sure that if I'm a family practitioner, am I certified in family practice? Did I take the boards? Did I pass those boards? If you're a surgeon, did you pass the boards in that specific surgical thing that you're doing? That's important because that at least sets it on a national standard. They at least passed a basic national standard kind of test to be at that kind of level of person. Some people might be board eligible, meaning that they haven't quite taken the boards yet. Then it's one of those things where you have to use your gut instinct or whether you like that or not. And then certainly if they're saying they're a surgeon, but you find out they're not board certified, this happens in a lot of states, particularly it seems to happen in Florida a lot, where doctors aren't even certified in the things that they're saying they can do. You also want to look at what are the hours of the facility that you're going to be going to. If my office is only open from 10 o'clock to 3 o'clock on Tuesdays and Wednesdays, well, even if I'm the best doctor in the world, it may not help you at all. You may not be a good site for you because you work on those days at those particular times, and you're never going to be able to make it into my office. So make sure that they have, extended hours, maybe hours in the morning, hours in the evening, potentially even some Saturday and weekend hours, because it really comes down to how easy is it going to be for you to actually get in and see that provider. If you're the best doctor, again, in the world, but no one can get in to see you because your hours are too cramped or you're too narrow of a spectrum at that time, you're not going to be able to get in to see him anyway. So that makes it very difficult for you as a patient, and so make sure that you like the hours and that they have maybe even some weekend hours available. Another big question they ask is, what is the same-day access? So let's say you call and you're sick, or you got an ear infection or a sore throat, or you cut yourself or you sprained an ankle. Are they going to be able to get you in that day and see you? Or are they going to go, well, he's kind of booked up, he can see you a week from now? Well, you'll either be dead by then, or you'll be cured. You won't even need to see him. So one of those things that you want to make sure is, if I am sick acutely, what are you going to do with me? Are you going to bring me in and see me in your own office? Or are you going to shuttle me off to urgent care or to the ER every time? What are those options available for that? Sometimes when you're waiting around or you're talking to friends or anybody else who's seen this provider, maybe ask them what are the average wait times. When you have an appointment, how long do you sit in the waiting room? How long do you sit in the room waiting to see the doctor? If you're waiting for extremely long times, well, maybe that's not someplace you want to spend your time, and so you might want to look at another physician's office. I always argue some people go into a practice and they see a full waiting room with a whole bunch of people waiting and go, this must be a really good doctor. I kind of argue the exact opposite. If you got a whole bunch of people waiting, it's because you're not efficient, you're not using their time properly, you're not using your time properly, and you're making everybody wait and your whole schedule's getting kind of backed up. A good physician that would hopefully have a very short wait time because you're getting patients in, the office is efficient, everybody's moving in and out very quickly, you're not going to see that much people waiting around. Part of our process when we built the office in Zeeland was we actually went with a premise that said, what if we had no waiting room? What if there was no waiting room? What would we have to do? How would our office have to operate in order to take a patient from the front door right back to a room efficiently and quickly, because we had no place else to put them? And so all of our processes that we came up with were kind of based on that premise. And we don't have a lot of people waiting in the waiting room, and hopefully we never will, because we actually designed the process to make it so that would not happen. Is the doctor by himself, or is it in a group? Sometimes there's positives and negatives to either one. A doctor that's in a solo practice, he may be a little bit more intimate. The office may be a little bit smaller. They'll probably know you by name and face every time you go in. But if he's on vacation for 2 weeks, there's nobody there to back him up. There's nobody else you can see. If you're in a group practice, there may be a little bit bigger office. They may not know you quite as well because they got a lot more patients coming in and out. But at least if your doctor is not available, there's usually other resources in the office available to see you, whether it be another physician and or other staff that can help take care of your needs. So there are some pluses and minuses to both of those, and you've got to decide which side of that coin do you want to be on. Once you've narrowed it down to maybe 1 or 2 doctors that you want to see, or even more than that if that's what you want, call their office and kind of ask them if they'll do a meet and greet appointment, or a time where you can actually come in for an appointment and sit down with the doctor and kind of just talk with him, meet him. Ask him some questions about his practice style. Ask him some questions about his philosophies of how to treat certain conditions. And most of the time, a lot of doctors' offices are starting to do this now. This is another thing that we implemented in our office on every new patient that comes in. We make sure that we do have a meet and greet appointment where we sit down, we talk to you, ask them questions, you get to meet the staff, you get to come into the office, you get to see how everything kind of operates, kind of before we make a commitment, before you make a commitment to come, and before even the provider makes a commitment to take care of you. So you can make sure that this is a site where you want to be, make sure it's a good fit for you before you start giving up personal information, before you fill out any paperwork. We don't charge for these appointments. It's something that you can do. And if you don't like to want to, or don't want to be a patient, you just leave, and that's the end of it. And if you do want to be a patient, then we give you the slew of paperwork and stuff you got to fill out to come into the office. That's a really nice way to go around. You can sometimes interview 2 or 3 doctors and find out, which one really fits you the best. Everybody has a different personality. Every physician has kind of a different personality, and you need to find one that you can kind of talk with on a very comfortable manner. So you take the opportunity to see their office, talk to the staff, make sure everybody treat you friendly when you came in. They didn't just push you off to the side and sit you down for a while. They make sure that the whole process from coming in and out was efficient and smooth, and something you feel like I can come back to this and do this over and over again. And again, ask some questions about practice style, office protocols. Make sure that those all meet with your expectations and standards. This is one of the most important relationships you might actually make. This particular person is going to take care of you, going to take care of your health problems. He may save your life. You want to be comfortable with that relationship. You want to be comfortable with that situation. You want to be able to feel free to tell them what's going on, and trust that they're going to give you information in return. Once you've found your new doctor, so there's a few things that you want to do when you go in for your first appointment. First of all, speak very frankly and openly about what your medical concerns are, and even what your concerns are with your health. Don't be reluctant or embarrassed to talk about problems. I've heard it all, and most physicians have. We've seen and heard almost everything. And there's a few times somebody comes in and throws something at me that's surprising, but it's not that often anymore. Be honest about what you think is causing your problem. You'd be surprised at how often you're pretty close to being right. A lot of people come in now, they've researched their issue on the internet, they've gone to WebMD, they've gone to several sites, and they've figured out some information, and that's great, and a lot of times you're not too far off. So sometimes that information can be very helpful. I always suggest patients prepare an agenda before they come in of what their healthcare problems are. You want to kind of rank those in order of sort of 1 through whatever, because you're going to have maybe about 10 minutes with that provider on average. If you look at the national averages for how long you're going to be able to sit and talk to that physician, about 10 minutes. Sometimes a little longer, sometimes a little less. So you're not going to be able to necessarily address everything on your list in that first visit. So pick out the first 1 or 2 things that you really want to get addressed. Make sure that those things have been put on the table and talked about. Then you can always come back for follow-up appointments to kind of discuss the rest. As a provider, it's very difficult for me to walk into a room and have that laundry list of things. If the patient has that expectation, we're going to go through every single one of those things in a 10-minute visit. I just can't do it. I can't follow that many items all in that time and give the patient any justice about what their concerns are. So it's okay to have the list, and we'll put the list in there and we'll talk about how we're going to address those. But those are the kind of things that you want to be prepared. So you're not going to necessarily get all of those things addressed in that first visit, but they're going to be maybe prioritized and addressed at subsequent visits. Do you have a question? Huh? Well, it doesn't have to be, but unfortunately...
Is that what the upper petrol?
No, that's just unfortunately where the economies of running a primary care practice have gotten us to, and it's unfortunate, but we have to see so many patients in a day to, I mean, legitimately, you're running a business, you have to have a financial endpoint, and you have to get patients in and out fairly quickly these days in order to make ends meet. But if the office is running efficiently, you're not wasting all that time in the waiting room, and you're prepared, that time can be extended. And so it depends on how, again, that's one of the things you want to figure out about the office is how well do they do that. If you're able to get in the room efficiently, sit down, have a preparation from your side, a lot of times you can get more time and get more accomplished in that period of time. You'd be surprised at how much you can get done in 10 minutes if you're focused and you kind of run things well.
Are you doing questions now?
Well, we have a question period at the end, but I'm willing to pop some things up.
Well, I'm just wondering, you know, when it's your first visit and you have a lot of complications health-wise, I could never do it in 10 minutes.
Well, the first visits are usually...
That you need more time?
Yes, I mean, that's obviously one thing that you can do. I'm just saying that's a national average of usual appointment times. I'm not saying that that's even our standard or anybody else's locally, but our new patient appointments are a little bit longer, and most offices have a new patient appointment that's a little bit longer. So you're going to, that first visit when you come in is usually going to be a half hour even, maybe even a little longer. Now you need to understand that doesn't always mean you're with the doctor that long. That means that somebody's in there putting all that health history into the computer. Somebody's looking at some of the specialty stuff, maybe even trying to get some records and notes and stuff before the doctor comes in. If you said you had recent x-rays and labs, they might be trying to pull those things and get them in. There's a lot that goes into a doctor's visit now that's way beyond what it was even when I first started. With all of the information we have to keep track of in the electronic medical record and all the data that we have to put in, there's a lot of information, particularly on a new patient, that has to be put in the computer. And before I can even come in to make that, make that visit efficient. So as a new patient, when you're coming in, a lot of offices, you might be there even an hour now, but it won't all be with the physician. It'll be with other staff, getting information, getting everything ready so that when that provider does come in, that you have the best quality time you can with them.
Couldn't you just schedule another appointment for the next week and the week after?
So rotation each time you go?
Well, you want medical care, you want medical care.
Well, in theory, yes. I mean, obviously, the physician's offices can be fairly busy. It might not be that easy to get one the next week and the next week, but certainly you can do follow-ups at those times. And you'll be encouraged to do those follow-ups, depending on what kind of health problems you have. A lot of times we have to bring you back and do other things.
If you have a new patient visit, then they schedule more time.
Yes.
Oh.
Yeah. Go ahead.
Is it advisable to call your previous doctor and have them send all your records over, or do they do that electronically?
That's a good question, but again, in our office, we wouldn't want all those records until after that meet and greet appointment when you've decided you're actually going to be a patient. What we don't want is a flood of all kinds of records of patients maybe we're not going to be seeing or that you're not going to be actually coming there. So part of our process after that meet and greet appointment is I will come in, meet with you, talk with you. Then we would say, okay, you're going to be a patient here. Now we have you sign the release of records. Then we send those out and try to get those records in, and then have you come back for your first sort of medical appointment. It takes sometimes 2 to 8 weeks to get medical records from some providers, and sometimes even longer. So a lot of times we're not always waiting for those old records. We're going to start doing some things just because those records can take a while to get here. The other problem is that now in the age of electronic medical records, either we're getting a ream of printed documents 300 and 400 pages long, or sometimes smaller, or we're getting mimeographed copies of printed or handwritten charts that were from way back. And it is very difficult to process all that information. It would take me an hour just to even look at all that stuff, not even talk to you. So many times those records will come in after you've already been there, or at other times, and then we review those at a different time during the day and put that information into your record. But again, we don't necessarily need that right out. Some offices will want that because they're going to assume they're going to take you right off, but we would fill those information out for meet and greet appointment. The point is, I think that you should take home is that we will get through your issues. It just may take a couple of visits. We just literally can't sit there and take up our entire morning with one patient. It just doesn't work. So that's unfortunately the reality of the system we have, and it is what it is. If you know that you're going to be a patient that needs more time, or that you think you need more time, just tell them on the phone that. That's the best thing to do, to say, I got 3 or 4 things I need to talk to the doctor about, and then say, can I get some extra time? Almost every office will provide you with extra time during that visit. So just say it up front. What becomes difficult is if you don't say that, and then you show up in a shorter appointment time and then want to stretch that out. Because one thing that every patient needs to understand is that every 5 minutes I spend extra with you is 5 minutes somebody else is waiting that's missing their appointment. So we have to be conscious of everybody's time when we're doing that. So just be upfront, ask, and that time should be allotted. There's about 10 questions. These are just basic ideas of things to help expedite that visit, as far as making sure that when you do leave, you get the information that you want, that the questions that you had are answered. And so if you come in, again, a little bit more prepared for that visit, a lot of times we have patients that they drive in, they're 5 minutes late, they come rushing into the room, and they sit down, and they really have no plan for how they're going to address that visit. They don't have anything laid out, and then everything gets kind of rushed, jumbled. You walk out and you might go, gee, I forgot to ask this, I forgot to ask that, I didn't get an answer to this. Well, some of that has to do with preparation. It has to do with preparation on your side about, what do I want to get out of this encounter? What do I want to get out of this meeting with the doctor? And if you have those things spelled out or written out, or at least some kind of outline of what you want to do, you're much more likely to walk out of there with the information that you wanted to get. So some basic questions is, what do you think is causing my problem? If you have a certain thing, ask, well, what do you think is causing it? And then we talked about you already telling them what you think is causing it, and then you kind of discuss those things and try to figure out what exactly the cause is. Is there more than one condition that might be causing my problem? What tests are available to help me diagnose this? How good are the tests? And then also, how safe are the tests? So those questions you want to maybe put to that. What is the likely course of the condition? Is it going to resolve rapidly without any treatment? Is this going to be a long, drawn-out thing where I'm going to have surgery and chemotherapy and all kinds of other things? What is the expected course? And is there going to be a cure, or is this something that we're going to only be able to treat? Things like blood pressure and diabetes and high cholesterol, we can't cure those things. So they're going to be an ongoing problem that's going to go on pretty much indefinitely. But we can treat them, but we can't cure them. So the course of that condition is going to be pretty much the rest of your life in most cases. What are my treatment options and how effective are they? There's any number of medications to treat, say, blood pressure or cholesterol. Which ones are the most effective? Which ones have the least side effects? Which ones are going to cost the least? I don't have insurance, or I have a high copay. Which ones are going to be the least expensive for me to get? If my symptoms worsen, what should I do? If you've asked that question ahead of time, then when you get home or something happens over the weekend, you already have a plan of what you know to do. Are you aware of the medications I'm on, and can they interact with the new ones you suggest? We're all going to be trying to do that and cognitively go through that. But if you ask the question point blank, it's really going to be, again, a situation where you're going to more likely get the answer you need, or make sure that there aren't going to be any interactions, side effects, or any allergy problems or things like that. And what side effects do you need to monitor for? Again, whenever we start somebody on a new medication, we try to tell them the top 5 or 6 side effects that may happen with that medication. You've all seen the commercials on TV where they go through a laundry list about 30 seconds long. Well, clearly we can't do that on every single medication. You can imagine our 10 minutes gets compressed in a long hurry if we try to do that with every single thing. So we try to go over the top main side effects. I try to do that for medications that I have patients on that I know what they've experienced. And I've used this medicine for a long time. These are the main things that my patients have experienced on this medication. I don't pull out the pamphlet and just start reading down through the entire list of everything that could be on there. In a world of kind of high deductibles and high co-pays, and sometimes not even having any insurance, how do you take advantage of the system a little bit to make sure you're getting what you need? Many insurance plans have preventative health that's usually 100% covered. What you really want to make sure when we talk about request labs billed as screening or preventative, or are they going to be diagnosis-based, you kind of need to know what your insurance plan covers for you. We don't know that. You assume we do, but we can't keep track of the hundreds of different insurance plans and types that are out there with any kind of accuracy. It's your policy. Make sure you know what it covers and what it doesn't cover. Does it cover a physical or not? Does it cover a screening colonoscopy or not? Does it cover a mammography or not? You should know the answers to those questions before we order them. If I order labs that are called screening, meaning I'm just checking you for your cholesterol. We don't know if you have high cholesterol or not. That'd be a screening test. If I know you have high cholesterol already and I'm checking it, that would be a diagnostic test. I'm not screening anymore. I already know the answer. You have high cholesterol. I'm just checking to see where that number is at. That gets billed actually differently to the insurance company from the lab. And so some insurances only cover diagnostic labs, only labs that are related to a healthcare problem that we already know you have. Other insurance companies will allow us to do screening labs that say a physical to kind of see what's going on. You need to know that question, because if we bill it one way or the other, it doesn't get covered. And then you're calling trying to go, well, I did these labs and they didn't get covered. Why didn't they get covered? And then we have to go through this long thing where we got to rebill and resubmit and do all that kind of stuff. So it's very helpful to know what those things are. And plus, it allows us to let us know what we can do for you. What can we get for you? What kind of labs can we order? What kind of tests can we do? What is going to be covered and not covered? And what is going to be, if it isn't covered, do we still need it? How expensive is it going to be? Those are all questions that you want to know. Make sure you take advantage of any preventative health stuff you can get. If your plan's part of the Obamacare plan, but it doesn't start until 2014, I don't think, is that every health plan will end up having preventative coverage. So you'll be able to get a physical, get some screening tests done, including mammographies and bone densities and other things like that. But as of right now, there's still a mix of plans out there. Not everybody does that. But if you do have that screening coverage, let's make sure we get as many of those things done as we can actually get done. Also, to try to cut costs, you want to quit smoking, which is a thing that causes... Smoking is related to, obviously, hundreds of different medical conditions. By quitting smoking, you're going to reduce your healthcare dollars and your healthcare need. Eat healthier, exercise regularly, and even lose that 10 pounds you've been talking about. All those things will make it so you don't have to see the doctor as much. If you don't have to see me as much, it's going to cost you less and not going to cost you as many co-pays. You're not going to have visit week after week after week because you don't need to, which is the ideal goal for all of us. Me as your provider, I want you to be healthy enough that you don't have to come see me all the time. You as the patient want to be healthy enough that you don't have to come see me all the time. If we're only seeing you for your once a year physical, that's great. It means you're doing really well. If you live a healthier lifestyle, you can keep up with your preventative care, then you won't need to see us as much, and that's going to help you save money. Questions on anything that we talked about?
What do you interpret as the difference between a DO and an MD?
What do I interpret as a difference? There's two kinds of medical schools in the United States. There's doctors of osteopathic medicine, which are DOs, and there's doctors called medical doctors, which are MDs. Medical doctor school or MD schools kind of started first. They're the original, going way back to the dawn of medicine. The DO school started sometime in the, I think, 1930-ish time frame, basically as a response to the fact that a lot of the MDs are very clinical, very study-based, very hands-off, kind of, they research, they do a lot of that kind of stuff at that time. And there was a group of physicians that wanted to be a little bit more hands-on, a little bit more involved with their patients, so they kind of got into that. DOs look at things kind of more holistically, where For instance, a cardiologist will just look at your heart and go, well, your heart looks good, and then you go walk out and you go, well, what about my knee? What about my leg? What about my back? Well, some of these things are all interrelated. You're not just a heart. You're not just lungs. You're not just a bad knee. You're a person with all of those things. And so DOs tend to, and part of their training is to look at how does one injury or one illness affect other parts of your body. Are many of your complaints actually intertwined because they're all related to a similar thread of health problem? We look at the whole picture and try to tie those things together a little bit more. You see, DOs tend to be in primary care medicine a little bit more than MDs do. We tend to be more in pediatrics and internal medicine and family practice. In fact, in the state of Michigan right now, we take care of 6 to 1 family practice patients as to MDs do. They tend to go into specialties and focus on one area, where DOs tend to take that broader picture and look at the patient as a whole. We also do a little bit of what's called manual medicine. And not all DOs do this to the extent of others. There are specialists now, DOs, that just do manual medicine, which is kind of like osteopathic treatment, where they can do manipulation and musculoskeletal kind of manipulation. Some DOs integrate it into their practice and treat things like that. If you come in, I can't tell you the number of times I've had patients come into my office that were seen in the ER a couple nights before for chest pain. They did a $1 million chest pain workup and it was negative. They come to my office and all they had was a rib that was dislocated, and we pop it back in and they're happy as a clam and their pain is gone. But as that sometimes that MD or the person in the ER doesn't look at that. He looks at, well, it's your heart and we got to check that out and let's go on that. But you turn out it just was a rib out of place. You put that back in, the patient's happy, and then that's all it was needed. So you got to look at the different causes of what might be going on. Your chest pain, sure, it could be from your heart, but it could be from a myriad of other things. Let's take a look at those too and do some of the simple things that might fix it before we jump into a lot of expensive testing. So it's more of a philosophy thing. However, nowadays, to be honest with you, if you go into any major hospital or any major thing, you're going to find that DOs and MDs are pretty much interchangeable. You don't really see, sometimes there isn't a lot of difference between them anymore. And that's a little bit unfortunate, but the mainstream kind of medicine has kind of pushed both of them. MDs have become a little bit more holistic, and DOs have become a little bit more specialized in some cases. So now most hospitals have a mix of both types. As far as states, we're all created equally as far as what we can prescribe and do. Surgeries, operations, hospital care, there's really no difference. So some of that stuff is pretty blended now. But traditionally, it was more of a training kind of thing. I was trained at Michigan State University. They have an MD school and a DO school. We went to the same classes, same teachers, same test, same grades, except when they got to go home for the day, we had to go learn manipulative medicine, hands-on stuff, the stuff that DOs do. So I always say that, particularly from our school, DOs are MDs plus. I mean, we did the same exact stuff, trained on the same bodies, the same microscopes, same teachers, but when they got to go home, we had to go learn more stuff. So in that sense, I always kind of brag that we were MDs plus. We have a little bit more information than they do. Go ahead. Well, how I personally feel about it is you've kind of entrusted me to be the one that's sort of the gatekeeper, the one that's kind of keeping track of your entire health care.
Because
and I can't.
Companies require you have a primary care provider.
But even if they don't, even if you, like you said, you don't have an insurance like that, if you've come to me as your primary care provider and I am your primary care provider, if you're just going kind of, I'm not saying willy-nilly, but you're going willy-nilly to all these specialists out there, how am I supposed to keep track of any of that stuff? How am I supposed to help manage any of that kind of stuff?
How does that make you feel?
Well, it doesn't make me feel positive or negative, really. It just makes me, I'm just saying, as your doctor-patient relationship is concerned, if you don't even trust your primary care provider enough to go to them first for that particular complaint and then refer you to a specialist, somebody that they trust and know is going to treat you appropriately, then maybe you don't have a great relationship with your primary care doctor. Also, if you don't trust them or want them to actually have all that information, be able to get that back and coalesce it for you into a primary, global look at your health, that's not good either. So your primary care provider is there to help you navigate that specialist market, which is, again, Where do you get your information from? Who do you see? How do you figure out where to go? What hospital do you want to go to? Who has the best program for this? Who doesn't have the best program for that? Who's the best surgeon in town to replace my knee versus my elbow? You know, you need to know those kind of things. And usually your primary care provider obviously is a good source for that information. They're in it. They know what's going on. Secondly is that if we've made that referral for you, you've come into our office and we've looked at your elbow and yep, you need to go get this as a referral, we get information back from that specialist. They send us stuff. They send us information about what happened to you. What did they do? They get us involved in your care, which makes it better, I think, in the long run for everybody. So that's kind of how I feel about it. I think you should be able to trust your primary care provider enough to go to him with any complaints you have and then sit down together and go, now where do I go with this? And
What if a specialist refers you to another specialist? Is that all right? Like you send them to a specialist and they refer you to somebody else.
yeah, typically that happens, and we don't, obviously you just want them to make sure that they pass on that we're your primary so we can get that information back. If you see a specialist who thinks you need to go see even a bigger subspecialist or something, well, that's up to them too. And so, but again, that chain you want to keep that chain of information going. Most things that happen sort of bad in healthcare these days is because of poor communication between providers, poor communication. You go in the hospital, you come back out of the hospital, and the doctor's there, you show up, and they have no information they didn't know you're in the hospital. And there you are following your hospital follow-up, and you're like, I didn't know you were in the hospital. And then you got to go try to find, well, was there any information I have about you being in the hospital? What meds did they change? What did they do? What tests did they do? It can be very time-consuming and very difficult with that. Lakeshore Health Partners, our larger medical group, is actually working towards being all in the same electronic medical record. That medical record is actually going to be tied to the hospital also. And so you'll have a much more seamless care as you go through that system where your information sort of follows you around and comes back, and everybody kind of can see everything that's going on. And I think that's going to be a tremendous tool in this community once we have that all done, because you're going to go see a specialist. He's going to be able to pull up your chart and have your entire chart there, not just some letter I said about, hey, she's got a painful elbow, go see, I want him to see you. She'll have your entire chart, all the medications you're on, every allergy you've had, all the surgical history, everything that's there is going to be there. Again, if you utilize that primary care relationship to get that information, then it can get disseminated a little bit better. Well, there is, again, it comes down to maybe a little bit of not really etiquette things, but certainly if you're having a bad experience with a physician, you definitely want to try to find a new one. And it can be difficult if you're in a small community and everybody's kind of booked up and there aren't that many providers taking new patients. It can be a challenge to find a new provider. The other thing that happens is a lot of providers in their office, if you have sort of a breakdown of a relationship with one of their doctors, sometimes it's hard to even move to a different doctor in that same office because just the way it works out if you can imagine if you're all living in a close family in the same house and you're not getting along with one, it typically affects the rest of the household and stuff too. So it can be a challenge, particularly if if there's one large group and it's the only one in town. Like in a community like this, we only have like one group of gastroenterologists. Well, if you're not working well with one of them, well, it can be difficult. Or we have one group of neurologists. Well, if it doesn't work out with one of them, a lot of times you don't have a lot of options. Sometimes you have to go out of town, go to Grand Rapids, go south or somewhere else to try to find somebody different, somebody that's outside of that environment. Well, I think the Holland Hospital actually has a referral page that actually has a list of doctors that are supposedly taking new patients. Now, that doesn't always mean that they're taking your insurance. We can be open to new patients, but maybe we're not taking any more Medicaid, or we're not taking any more Blue Care Network, or maybe we're not taking any more of a particular insurance plan. We may have a cap on how many patients are in that, but if you have a different insurance, well, maybe we take that. That varies from office to office, and there's really when you're looking even to try to find your physician, there's little information about that. It's even harder to find good information about who's accepting new patients and whose offices are accepting your insurance. One place you can try is call your insurance company up and see if they have a list of doctors they know are actually taking new patients.
Now, make sure your group is not affiliated with MMPC or Spectrum, right?
No, we are not. We are actually affiliated with Holland Hospital, where you guys are all at tonight.
And Zeeland Hospital?
Zeeland Hospital is now Spectrum Hospital, so. I'm from, our office is in Zeeland, but we're not.
Oh, okay.
We're not.
You have any Holland offices?
Yes, we do. In Lakeshore Health Partners, we do. Yes. Well, there is. I think our information has our website on it, and on that website has all of our groups, from internal medicine to family practice to all that. And so all you need to do is go on there and find the office that's close to you again.
Right.
Which one's on the side of town where you live? Which group has physicians that you want to see? Do you want to see an internal medicine doctor? Do you want to see a OBGYN? Do you want to see a, if obviously you're not a kid, but if you had kids, do you want to see a pediatrician? I mean, you got to kind of pick that out. Or do you want to see a family doctor? Then gives you those lists. And then what you do then is you call and go, hey, yeah, spend a little time on the phone and go, I'm looking for a new doctor. This is my insurance. Are you accepting new patients? Yes, then make an appointment. Internists only see patients typically 18 and older, and they typically specialize in sort of more complicated cases. So if you have multiple medical problems, let's say you're diabetic and you have hypertension, hyperlipidemia, and you have had a heart attack and a stroke, you have multiple things that have gone on, a lot of times an internist might be the best choice for you. So there's a sort of a dividing line, and it's sort of a hypothetical dividing line, but if you do have a laundry list of 15 different ailments and problems, well, sometimes you might want to see an internist. The only reason you would is because if you are on a lot of medications and you're getting treated for a lot of different things, they have a little bit more depth of training in how to organize all your meds, make sure those meds aren't interacting with each other, make sure there aren't side effects, following those more complicated types of cases. In our practice, say, even when I'm seeing patients, there's a few patients at that meet and greet appointment will come in and I'll talk to them about their healthcare needs, and they might have a lot of things going on, and I'll say, look, I think you'd be better served by one of our internists. And then we'll go out and make a phone call, and we'll set them up with an appointment with one of our internists, and then they go over there and they see one of them instead. And it just comes down to how complicated your health really is. Now that doesn't mean you can't go see an internist. If you're 18 and older and all you want is a physical, you can still go see an internist. They'll still do it. But they kind of specialize and have extra training in sort of being in a little bit more complicated sort of health problems. And traditionally, kind of internists were the people that took care of you in the hospital. They're the ones that are usually the hospitalists when you come in and get admitted. Those are usually internal medicine physicians. So they just have a little bit more depth of training in more complicated health issues. Or if I have you on 2 or 3 medications I've tried to bring your blood pressure down, and I'm just not getting anywhere. I can't figure out why your blood pressure won't come down. Sometimes I'll refer you for a consultation with an internist to see if they could have any input on how, what else might be going on, what am I missing that we need to try to focus on to get that blood pressure down. So a lot of it just as a family practice doctor, I see everybody from birth to basically death, everywhere in between. They kind of narrow their spectrum down to mostly adult medicine. There are some intern pediatricians, and they specialize in complicated kids. So there's specialists for everything. It's actually getting very common these days. The problem is that hospital medicine has become very complicated. It takes a lot of time to come into a hospital and round on patients and then go back to your office and then try to see a bunch of patients. What happened was that you never went home. You were constantly either in the office or in the hospital, and you had really very low quality of life outside of that. So what's happened now, as in here, a whole other group of specialists has come along called hospitalists. And most major hospitals now have a whole team of hospitalists. They specialize in nothing but hospital care. They don't have offices outside of the hospital. They don't see patients outside of the hospital. They only take care of you inside the hospital. And it's actually probably best, I think, for most patients, and it's best for most doctors that way. If I was to take care of all of my heart failure patients, let's say, I might only admit 4 or 5 a year. Well, that might not be the best situation for you to be in. You might rather have somebody who's here every single day taking care of 4 or 5 heart failure patients all day long. So you're just going to get a little bit better quality of care, I think, sometimes that way. the communication becomes the key now. And so when you have hospitals programs, you have those kind of things going on, there has to be good channels of communication. I know when my patients come in the hospital, they send, as soon as you get admitted, they send my office a note saying that you are in. I can actually go on my computer and I can track your entire hospital stay. I can look at every single day, every single note that they write on you. I can follow every single test that's being done. And I may not be able to intervene. I'm not calling up and saying, hey, you should do this or do that. Sometimes you can call and make a suggestion. But at least when you come back out and you come back to the office, it's usually not a big surprise that you were there. I kind of know what happened. I got a general idea why you were there and what they did. And it makes it a lot easier to make those transitions back and forth. I cover the hospitalist program here every once in a while, and sometimes we will, if we can, call the patient's physician and ask him some questions. What was this? Particularly, a lot of it comes down to meds and doses. A lot of times people come in, they don't know doses or even what meds they're on, and so we're trying to get that straight so we can make sure we treat you. And or if there's been a complicated readmission and exit history where they keep coming back for the same thing, try to coordinate some care to try to prevent them from either having to come back in as soon or to make sure that when you get out there that you're getting the appropriate care. So yes, that does happen. And it's going to be, again, one of those things that happens even more and more as we get onto the same electronic medical record, that it's all about improving communication. And we're always looking at ways to try to make that better. Well, there is in Grand Rapids. I don't know, there's not a lot of that here in Holland, but there certainly are entire clinics in Grand Rapids of sort of alternative and complementary medicine.
Do you know of any names?
The Bourne Clinic.
Besides them?
No, I mean, I know there's some other ones there, but
They're good. No doubt. I thought there might be something, I don't know.
there probably is. Again, I don't know every single practice that's out there. So, alternative medicine and things are very much a provider-specific kind of thing, and it's not. I can't say it's something our entire group would do or not do. Each individual physician will choose to do what they believe is best for their patient in that scenario, and so. Again, part of the question about DOs tend to be more open to that stuff. We tend to be more open to things like acupuncture and herbal medicines and those kind of things, only because we're not so stuck on everything being double-blind, placebo-controlled, tested and double-tested and all that. That being said, however, I also would counsel my patients if they tried those things and they don't work, or they tried those things and have problems, that we need to move on. We need to do some other things. There are some health problems that need to be treated with medications that, herbal and holistic stuff just are not going to be appropriate. And so, again, you need to have that communication, and that's part of the meet and greet appointment. I get that question quite a bit, and that's a very important question to ask at that meet and greet appointment. If you believe in herbal medicine, you believe in kind of holistic stuff and alternative therapies, you need to throw that on the table right away and say, I kind of believe in this stuff. Will you work with me with this? And if they say no, well, clearly that's not going to be the right place for you to be. I mean, if they go, nope, that stuff's a bunch of hooey, I don't believe in any of it, well then definitely that's probably not the right place for you to establish as a doctor, or as a patient, I'm sorry. All right, I know it's kind of snowing hard, and everybody needs to maybe get out of any more two last questions. Anybody got anything? I guess my biggest pet peeve is that I like, patients kind of want me to be on time. I kind of really expect them to be on time. And so I can't be on time if my patients aren't on time. It just doesn't work. And so probably my biggest pet peeve in my office is trying to make sure patients get there, not the moment their appointment starts. I mean, if you have an appointment at 1 o'clock, that doesn't mean you walk in our front door at 1 o'clock. That's, you're supposed to be back in the room allowing me to walk in and see you at 1 o'clock, not be walking in the front door. It takes about 15 minutes for you to get from our front door through your, the intake system and back to the room, checking your insurances, doing all that kind of stuff. So if you're only walking in the front door, your appointment time is supposed to start, then you're eating into your minutes. If I have a half-hour appointment for you, but you don't get in the room until 1:15, your appointment just went down to 15 minutes. And unfortunately, then your expectation is I'm still going to spend a half hour. Well, and I'm telling you, that's the pet peeve. Is that it's not your appointment is with the provider. Your appointment is with being back in a room. That's what it should be at 1. Now, in our office, we accommodate for that, and we actually tell you, we give you an appointment time yeah, your appointment's at 1, that means you come in. My appointment with you is at 1:15. So we already accommodate for that in our practice and make sure that we have a window. But that's probably one of my little things. And then also you should come in with a little bit of an open mind. Don't come in already having made your mind up about what your problem is, what your treatment should be, all that kind of stuff. You know, it's good to have an opinion. It's good to put that on the table. But also be open to feedback. Be open to listen to what other alternatives and other options there are. And be open to trying or even discussing those kinds of things. It's very hard to treat patients that are very closed-minded or come in, well, this is what it is and this is what I want, and that's the end of it. Well, then you don't really need me. I'm not, you know, if you're not going to allow me to be involved in that decision and involved in that treatment, then you can go, you know, get whatever it is you need somewhere else and be done with it. So that's another thing, is I just want you to be kind of open and open to ideas and thoughts and different options. And I'll try to do the same back to you. I'll try to feed you back with open options and choices, and not just say, well, you got to take this medicine and there's no other alternative and listen to me on the doctor. I won't do that to you either. But you got to be that way kind of back too. I totally agree, and I talked to you a little bit about our opening of our practice before, and that's exactly what we thought of everybody as. You're our customer. You're somebody that we need to treat with respect and treat your time with respect. And how will we treat you as if we're competing, like we're Walmart and somebody else is Myers, and we're trying to make sure you come into our store and not their store. And you're absolutely right in that there has been a shift in some of the better practices, major practices, about trying to do that. You don't have to come see me for your medical care. You can go, you have lots of choices and lots of alternatives. It's my job to make you want to come see me for those kinds of things. And then to make your experience in our office as pleasing as it can be, so that when you walk out, you say, hey, I want to come back, or I want to refer other people here. I want to tell other people this is how this practice goes. So you're absolutely right in that's a great turn for customer care and patient care. If you call and don't have a particular, like you say you call our office and say, I want to be a new patient. I don't really know who you got there, but I want to be a new patient. Then yes, they'll assign you to a physician. You'll have a meet and greet appointment with that physician. We've had a few patients that have actually set up meet and greets with every physician in our office, and then decided after that which one that they wanted to go to. But I'm just saying that's that does happen. So not that I don't necessarily encourage that, only because it's very time consuming, but. Certainly, if you don't like the first physician, or maybe you like him but just wanted to see what else was available, you could definitely do that. So. Well, if you don't have any opinion about any of them,
yeah, you just have a name.
Then you can just call and you could pull. It's like pulling a rabbit's name out of a hat. I mean, you're kind of doing that. It's unfortunately, hopefully you can again research that list a little bit more, try to find a little bit more information. Ask friends and family if they've ever been to that group. If they've been to that group, who did they hear was better in that group, or something like that, because it's always amazing. We spend more time buying washing machines and picking out a car than we do going to pick out a doctor. I mean, it's kind of insane. I mean, you'll go to bed. Well, you guys are actually here and investigating a little bit, but I mean, most people, they'll spend more time at Best Buy trying to get information on a washing machine than they do on their doctor. And I think that's a little bit sad, but some of it has to do with it's hard to get information, but that's becoming more and more available. But I'm just here to tell you, do a little bit more research, ask a few more questions, do a couple of meet and greets, and try to make sure before you commit to a relationship that it's something that you are going to enjoy long term, something that's going to be beneficial to you long term, and that your personality and that what you have as far as your goals in healthcare meet well, and that way you'll have a very good relationship, you'll get better care, you'll enjoy it better, and in the long run, that's what everybody wants, including your physician. Dr. Barbara Dupree is a female provider who specializes in postmenopausal kind of medicine and women's health. She's in our office upstairs and has space up there. She doesn't do general primary care, so many of her patients come down and see one of us or have a different primary care provider outside of the office. We just, starting tomorrow actually, recruited a new female family practitioner who's going to join Dr. Barbara Dupree, and she is going to be doing female primary care, female general primary care, actually in conjunction with Dr. Dupree. So to answer your question, give it about another 3 days, and in her office will be another doctor that can take care of all those things for you. We do have physician's assistants and nurse practitioners. They are very good, and I would encourage anybody to see any one of them. A lot of times they're working mainly in our walk-in care that we have there, but they also do see patients. All of our mid-levels are females, and so they do tend to take on some of the female patients who need primary care. And they're always in conjunction. We've all paired off as doctors and mid-levels, and that we provide sort of concerted care. So it's never that you don't have a physician. You're still going to be assigned a doctor, and you might see the mid-level, but the mid-level talks to the doctor, and there's kind of some interrelationship there. So we have patients that prefer to see our mid-levels as opposed to some of the physicians. So again, it comes down to personality and philosophy and all that kind of stuff. So there was no one else to go. I mean, there was nowhere else to go. We had to send patients to Grand Rapids. The good news is they just got a new guy in the office. A new neurologist just started a couple weeks ago. And I think there's 2 more that are going to be starting over the next year. So, our neurology group is actually going to grow by probably 3 providers over the next year. So there is a new doctor there now, and he is accepting new patients. So we are sending patients here now. In Dr. Van Dornick's office. Yeah. Dr. Robbins is there now, and then also there's another new one. So there's actually 3 doctors in that office now. And there'll be, I think, 2 more coming, so at least 1 for sure, maybe another one, I think, too. All right, everybody, thank you very much for coming in, and be careful driving home. Thank you. If you have any questions, feel free to call.